ahead and get started. We've got a great speaker lined up to kick us off for the afternoon, and that is Dr. Jack Wazen. And Dr. Wazen graduated from the American University of Beirut in 1978 and completed his residency in otolaryngology at the Columbia Presbyterian Medical Center in New York City in 1983. Otolaryngology. That's eye, ear, nose, and throat. It also involves the head and the neck. All these things going on around the brain, and that's why he's here today. He's a board certified in otolaryngology and board sub-certified in neurotology. After a one-year fellowship at the Ear Institute Foundation in Sarasota, he joined the faculty at Columbia University College of Physicians and Surgeons in 1984 as director of otology-neurotology. I did my best. Dr. Wazen returned to Sarasota in 2006 to become a practicing partner of the Florida Ear and Sinus Center at the Silverstein Institute and was named the Vice President and Director of Research for the Institute's nonprofit Ear Research Foundation. He also serves on the Board of Trustees of the Hearing Loss Association of America and serves on the Medical Advisory Board of the Vestibular Disorders Association. He continues to conduct and participate extensively in research and publishes and lectures regularly. Here to share with us how hearing loss impacts brain health, ladies and gentlemen, please join me in welcoming Dr. Jack Wazen.
I think we should have a round of applause for you for trying your best. It's a tough specialty. So thank you for the invitation for addressing me today. And I was at the hospital this morning at the education meeting, and somebody looked at me and said, "Well, are you giving a talk today somewhere?" Because I had my jacket on, and I said, "Yes." And I told them where I was going, and they said, "Why are you doing that?" And I said, "Because I think it's a hot subject, it's an important subject, and I wanted to learn from all of my other panelists about what's going on in this field." So I hope we just continue to learn from each other, and my role now is to impress upon you some of the latest information on how hearing is important in brain function and in cognitive function. And as the earlier speaker said this morning, things that we can do and we want to do to delay the degenerative change and to make sure that our brain function is optimized. One of the things that was missing from their prescription is hearing. So let's talk about that now. So Helen Keller, famous deaf and blind person, says deafness separates people from people. And it's an important statement that just kind of gives me goosebumps to make one appreciate how important hearing is in our everyday life. So, just a brief review of what does hearing do. The hearing system is one of the earliest to develop, and it's been available since the beginning of fish, before even mammals came on Earth, and before the beginning of time. It is crucial in the survival instinct of animals. You know, for an animal to be able to survive, thank you, they need to hear. They need to hear that a lion or a tiger or somebody is coming to. It's not necessarily wanting to see it or smell it, but hearing it was very crucial. Hearing affects language, it affects communication skills, it affects learning skills. How often do we say, "Have you heard?" What we learn every day is, "Have you heard?" Sometimes it's "Have you read?" but oftentimes it's "Have you heard?" So, and of course, our emotions are very much influenced by our hearing. And one of the most complicated hearing compositions is not necessarily language, but music. Music is so important in our hearing, in our brain health and brain activities, that it's just to give you some examples of emotion, of hearing and emotions. So what do you feel? Yeah? Now this is, all of a sudden, people are nodding, they want to get up, they want to dance, it's upbeat, that's emotional, huh? Now, Symphony number 9, E minor, it's sadness. So when you hear music, this will make you happy, it'll make you sad, it'll make you afraid. Number 1. So all of that is based on our hearing mechanism. So our hearing mechanism is starting at the cochlea, at the inner ear level. And the cochlea is tuned, like a piano is tuned. Every part of this little snail is responsible for a particular frequency. All of that comes into the brain stem, and it's channeled up the levels, up to the level of the brain. Right here, on that part of the brain, that's where the hearing center is. Now, if you look in here, along the trajectory going from the ear up into the brain, it passes what was described earlier today as the limbic system. The limbic system is the area of emotions and of memory. Hearing has a stop here, and it goes from here up and then from the cortex down, but there is a connection between the hearing system and our emotional system. One thing also that you need to keep in mind is this is where hearing is processed in the brain, this is where vision is processed in the brain, this is where speech is processed in the brain. And one thing that we've learned over the years recently through different kind of research with people who have been hearing deprived or children who have not heard is that when this part of the brain is not stimulated, then different parts of the brain takes over. And we've seen the visual cortex expand to occupy the area of the hearing area because the hearing has not been utilized. So it's not, there's vacancy here. The brain is a very smart thing. So if this area is not being utilized by hearing, the other neighbors are going to come in and occupy. Now, when they come in and occupy, it is very difficult to kick them out. So, and all of these Mukanga associations know that. So you don't want to leave a vacancy, and you don't want people to come in and occupy your space. And one way you keep doing that is by continuously stimulating your auditory system so it stays healthy and stays available. So recently, a big organization has come up with a study on hearing healthcare for adults. This is the National Academies of Sciences, Engineering, and Medicine. It's a big deal. They came up with a publication on that, and here are some data and some statistics. About 30 million people in the United States have hearing loss. Very common. Hearing loss identified as the 5th leading cause globally of years lived with a disability. Furthermore, as the U.S. population of older adults increases, hearing loss will become an area of greater concern. And hearing is a vital human sense that can be important in communication and health and can affect quality of life. Yet, despite all of that, many people with hearing loss do not seek out or receive hearing health care. And one of the earlier speakers today talked about stigma, and there's a big stigma about hearing loss. Nobody wants to talk about it. Everybody knows this person is out of hearing, that person is denying it. So you can't hide it. If you have it, you have it. You gotta work on fixing it. Only about 67 to 80% of people who may benefit from hearing aids are not using them because of the stigma of hearing aids. And sometimes it's because of the cost. Long seen as an issue for individuals, now there's a growing recognition that hearing loss is a significant public health concern that has to be addressed at multiple levels. So the National Academy of Sciences and Engineering and Medicine has convened an expert committee, and they advise the government, they advise the Medicare, they advise healthcare on what needs to be done. So using a set of guiding principles, the committee recommends key institutional, technological, and regulatory changes that would enable consumers to have better, affordable, and higher quality services. Hearing loss must be recognized as a public health concern, influenced and affected by decisions and actions at multiple levels. Improving the accessibility and affordability of hearing health care will require solutions that span society. So, the United States population, 65 years and older, grew tenfold between 1900 to 2000. However, the population under 65 only grew threefold. So that's why you hear about, the aging of America, because the older age groups are becoming much more numerous, tenfold instead of threefold. The 85 plus grew 30-fold in the same time frame. And most of us are in Sarasota. So by 2030, the older population, which is over 65, will double what it was in 2000. Although the general US population is projected to be smaller. So Florida has the highest proportion of older people, 16.7%. In our practice, it's more than like 60%. But California has actually the largest number because it's a bigger state, followed by Florida and New York. And you could see here how this graph shows how the increase in the elderly population as we go over the years here. So, the most common type of hearing loss is called presbycusis. It's age-related hearing loss. It's the most common cause of hearing loss and the third most common chronic condition in the non-institutionalized older population. It strains interpersonal relationships, it creates social isolation, and it causes depression. Numerous studies have confirmed a relationship between hearing loss, cognitive decline, and dementia with aging. So why is there an association? What is it? What are the hypotheses of this auditory and cognitive decline? There are three hypotheses. The first one is called the common cause hypothesis, which means we're aging, our nerve cells are being assaulted by these free radicals, poor circulation, etc. And both the auditory system as well as the cognitive system are secondary to the same kind of neural degeneration. And that's why the two are coexisting in that individual. The second theory is called the degradation hypothesis. And that means with poor auditory performance, it compromises the cognitive function by reducing the information that is available for processing. So the less you hear, the less information you have to process information. So that's the loss of hearing is creating a degradation in the information pathway. And the third theory is called the cognitive load hypothesis. And that means there's poor working memory limiting the auditory performance. The cognitive load means that you guys are so busy trying to hear and understand what is being said that that's taking away from the energy and the neural function to produce other results. So I tell people, when you're hard of hearing, it's like you're squinting to read. You're putting too much effort to hear that takes energy out of the rest of your brain function. So multiple studies have been done. This guy, Gates, in 2002, talked about central auditory speech processing deficits being an early manifestation of probable Alzheimer's and preceding the onset of dementia. Hear and understand in noise and cognitive decline. Choi in 2011 wrote that, asked the question, is cognitive function in adults with hearing impairment improved when you use hearing aids? So will that negate the effect of the decline? And so they took 18 individuals and they fitted them with hearing aids and compared them to those without hearing aids, and they found that speech-related cognitive function improved with the use of hearing aids. The biggest and the most widely publicized study was the Hopkins study, and a lot of people here have talked about it and have read about it. And in this study, it also shows that there is an independent association with hearing loss and accelerated cognitive decline. Hearing loss causes social isolation, loneliness, increase in the cognitive load. Greater resources are dedicated to the auditory perceptual processing to the detriment of other cognitive processes such as working memory. So, deprivation of auditory input leads to reorganization of the map of the auditory cortex, and we talked about that, how if it's not stimulated, it's being utilized by other factors. So, and so on and so forth. Multiple studies continue to show the same idea, that hearing and cognition are related. So, why do we continue to ignore it? Hearing loss affects the quality of life, social interactions, motor skills, psychological aspects, and function and morphology in specific brain areas. Long-term hearing deprivation can impact cognitive performance by decreasing the quality of communication, leading to social isolation, depression, and facilitates dementia. So effective intervention with hearing aids or cochlear implants may improve social and emotional function, communication, cognitive function, and quality of life. So I hope I did not go very rapidly through this, but I had a lot of information to squeeze into 15 minutes. Did I do it?
You did. Who would have thought that perhaps something as simple as a car